Now let's see the non-stress test. So as its name implies, this is a non-stress test. This is a test in which we are just going to observe what is happening with the fetus. And let's say this is an indirect way to evaluate for fetal movement. So this is usually the mother can feel the fetus's movements around 10 fetal movements during 2 hours. This is normal. The mother will feel around 10 fetal movements during 2 hours. We evaluate how many fetal movements does the mother feel during 1 hour, and the indications for do a non-stress test is if the patient has diabetes mellitus or hypertension or intrauterine growth restriction, or if this is a post-date pregnancy, for example, greater than 40-week gestation, so post-date. These are the most common indications to do a non-stress test, but basically every patient that has risk factors for fetal demise, we are going to do a non-stress test starting at 32 to 34 weeks gestation. Unless it's a patient that has a lot of risk factors for fetal demise, then we will start between 26 to 28 week gestation to start doing non-stress test. Now, what or in which consists the non-stress test? This is, we are going to measure the acceleration of the heart rate, which this is in response to fetal movement. So it's an indirect way to evaluate fetal movements. So if we have acceleration, this probably is because the baby is moving. So the criteria to have a reactive or reassurance non-stress test is we need to have more or equal than 2 accelerations during 20 minutes of evaluation. This is the criteria. Now, how do we define an acceleration? An acceleration is going to be an increase in heart rate from the basal heart rate, an increase. If the patient is less than 32 weeks gestation, we should look for an increase in heart rate greater or equal than 10 beats per minute, which needs to lasting greater than 10 seconds. But if the patient has more than 32 weeks gestation, then we are looking for an increase in heart rate greater or equal than 15 beats per minute, lasting more than 15 seconds. So this also depends on the gestational age. So let's suppose here we have this is the variability of the heart rate of the fetus. We are looking for an increase in heart rate. This increase, so from here, like the baseline to the top, this should be 10 or 15 beats per minute depending on the gestational age, and should last more than 10 or 15 seconds. And the acceleration is a gradual acceleration. This means that the acceleration it takes more than 30 seconds to complete the acceleration. So from here to the greatest to the top, this is more than 30 seconds. And the whole duration of the acceleration is less than 2 minutes. Because if we have an acceleration that lasts more than 2 minutes, then we are not calling that an acceleration. Then that is called a new baseline for heart rate. So in summary, we are looking for an acceleration which is more than 10 or 15 beats per minute, lasting more than 10 or 15 beats per minute, which is a gradual acceleration. So from beginning to top is more than 30 seconds, and lasting less than 2 minutes. If we find 2 or more accelerations during 20 minutes, this is a reactive or reassurance non-stress test. In the case that we have a non-reactive non-stress test, in the case of non-reactive non-stress test, this means that the criteria was not that this criteria was not met. So either we had no acceleration at all, or we had accelerations but no more than 2 accelerations during the 20 minutes we are evaluating, or we have accelerations but with low amplitude, so not amplitude needed, for example. So summary, non-reactive non-stress test is this criteria is not met, and the etiology for that is the most common is the baby is sleeping. So if the baby is sleeping, the baby is not moving, so we are not detecting an increase in heart rate. And so what do we need to do if we suspect the baby is sleeping? We do vibroacoustic stimulation. So this is again a non-invasive test. We do a vibroacoustic stimulation. This is going to wake up the baby, and then we evaluate again the increase in heart rate. Other etiology for non-reactive non-stress test is prematurity. So if we have a premature baby, for example, less than 32-week gestation, we are not going to detect that. Less than 32-week gestation. Or could be that the fetus is sedated. This is that the mother is taking sedative drugs, for example. And if the vibroacoustic stimulation was not successful, so if after having a non-reactive non-stress test and doing vibroacoustic stimulation, and again we have non-reactive non-stress test, then we do a contraction test, which is we induce contractions, not labor contractions, but we induce contractions. So giving some oxytocin to the pregnant lady to have contractions of the uterus, and in response to the contractions of the uterus, we should see early decelerations, which we reviewed that topic in the previous videos. But so the non-stress test is a non-invasive test when we should see more than 2 greater or equal than 2 acceleration during 20-minute window of an increase in heart rate being 10 beats per minute lasting more than 10 seconds in a less than 32-week gestation lady, or more than 15 beats per minute lasting more than 15 seconds. If this is a non-reactive, non-stress test, the most common cause of this is that the baby is sleeping, and if this is the case, we do vibroacoustic stimulation. If besides this we still have a non-stress test, we do a contraction test, which this is a contraction stress test because we're stressing the fetus. And other etiologies for non-reactive, non-stress test is prematurity, or that the baby is sedative because of sedative drugs the patient is taking, or could be that the fetus is hypoxic. So every non-reactive, non-stress test that is not reactive after vibroacoustic stimulation then should be evaluated with contraction stress test or with biophysical profile, which is what we are going to review in the next video. And remember that non-stress test is done basically in women with high risk for fetal demise, which is diabetes mellitus, hypertension, post-date, and that the fetus has intrauterine growth restriction. This test starts between 32 to 34 weeks and beyond that, or 26 to 28 weeks, starting 26 28 weeks in very high risk patients. And if we are doing the non-stress test, we basically do non-stress test weekly or bi-weekly. So we do non-stress reactive test, non-stress test. If the non-stress test is reactive, then the positive predictive value, or the probability that the baby is doing well, is very high, and we repeat non-stress test in a week or bi-weekly. But if the non-stress test was not reactive, then we do vibroacoustic stimulation, and if this return a reactive test, so the same, we repeat the non-stress test in a week or so. But if after vibroacoustic stimulation we still has a non-reactive, non-stress test, we confirm or we evaluate this with contraction stress test and biophysical profile.